Everyone, please join the quiz. We'll be starting soon. We'll be starting at exactly 10:10 p.m. Link of the quiz is shared in the Telegram group. You can also copy this link, which is shown on the screen right now.
And welcome back, guys. From today, we have surgery for next 7 days.
Today is the first day of surgery quiz. Today we are covering general surgery. Link of the quiz, YouTube live link, and the quiz link is shared in the group right now. You can see group also, Telegram group. You can also join from Dr. RMD WhatsApp channel, where the link is shared right now.
And please tell your friends as well to join the quiz. We'll be starting in few minutes. We have one drug also, sir, today.
We have one.
We have one drug also, chloramphenicol.
Oh, okay.
And also, I can see Vipul, sir, Vipul's.
Winner is also there.
Yeah, yes.
Yesterday, someone was impersonating me from last 2 3 days.
We thought you were in the quiz, but we knew that
And
someone.
yeah, it was something else.
Mm.
So quiz link has been shared in
And
the YouTube comment section, live chat. So you can join directly through the live chat. So please join quickly. We'll be starting in next 5 minutes. We already have 25 players who have joined. Rest of them join quickly. We'll be starting quiz at 10 p.m. That is in next 5 minutes.
yeah, please tell your study partners as well to join the quiz. Guys, everyone who is in the quiz can answer every question. There is no negative marking here. So please
Yes, that
don't
is
leave any
important.
question blank.
Yeah, we
Give
have seen
them.
some people were slow
Yeah.
in answering and some of them were hesitant to answer. So the faster you answer, the more marks you get.
Mm.
Okay, so this is a time dependent quiz. The faster you answer, the more you get, and you should be fast and you should be accurate. You should be both.
Yeah. Eventually, when you get adjusted to this 30 seconds, you'll feel neat timing is very easy.
Yeah, right. So 3 more minutes to go. So today also we'll be having 10 questions. Surgery again is one very important topic from where many number of questions have been asked. And in the last 3 to 4 years of question paper, you'll notice that in NEET PG, more number of questions are being asked from surgery. And as day passes by, a year passes by, you will notice that more number of clinical based questions are being asked, more number of concept based questions are being asked, and more number of questions are being asked from today's topic, that is general surgery. So that's why we had focused more on general surgery and we had given one full day for general surgery as against topics like lower GIT, where in lower GIT content is too much, but number of questions are very less. That's why we have given only half day for lower GIT. So all these things, all this timetable which you notice, that is in accordance to the timetable that I had provided in my video on Dr. RMD YouTube channel in named by NEET PG Strategy 2025. Okay. So in this NEET PG Strategy 2025 video, you will find for the top 10 subjects, we have prepared this timetable. Okay. So according to that timetable, we are preparing this and we are conducting this JuxtaMed quiz. Okay. So most of you who are participating will be knowing that, and those people who are new to the quiz, who are participating right now, you should note that we are having this quiz for the sake of completion. Okay, like whenever you study, you need some validation, you need some source to keep you motivating that you have studied, and you need some source of a source to judge you that you have studied well. So that source is this quiz. Okay, so use this quiz as a positive approach and not negative approach, and also you'll note how competitive the competition can be. Okay, like it is so competitive nowadays. That's why you will notice that when you are solving the quiz, how people are ahead of you. Okay, so you should reach that level of preciseness, and also you should reach that level of time management when you solve questions. So I think we are good to go, Dr. Manoj.
Yes, sir, we'll start.
Okay, today me and Manoj will be hosting this show. So let's start. So welcome everyone to JuxtaMed quiz on general surgery. I'm Dr. RMD and I'm thrilled to be hosting alongside Dr. Manoj. Let's step directly into this challenge.
Okay, guys, here's your first question. Surgical blade number 11 is best suited for which of the following procedure?
So think about emergency interventions or creating precise entry points. You will know the number of blade if you remember the image. Okay, if you've done your internship well, then there is no doubt at all. I still remember surgical blade numbers because of my
Yes,
internship.
sir, true.
So those who haven't done internship properly, you will stuck at this question. Yes, it is used for stab
Yes, sir.
incision, INT,
I think
because
this
it
is
has.
the
Yes, Manoj.
yes, yes, sir. No, sir. I think as interns, I think this is the most used blade than the surgical
Exactly.
blade number
Yeah.
22.
Yeah. So let's see at the leaderboard. Karthikeyan is leading, followed by Krishna, Sushma, Shanmugapriyan, and Rima. All are at pretty much very close points. So let's move on. So here is your second
Yes, sir.
question. Reverse Trendelenburg positioning is commonly used to improve surgical access to which anatomical region? So if you know Trendelenburg, you know reverse Trendelenburg.
Yeah, to give a clue, this is perfect for when you need better access to structure higher in the body. In this position, the head is elevated while the feet are, which helps in reducing the venous congestion and improving the visualization in the upper abdomen as well as head and neck surgery.
Yeah. So to get a clear field for abdominal surgeries, we use this reverse Trendelenburg position. So the next question is, where is Trendelenburg position news? Those who are watching this quiz through YouTube live session in live chat, you can reply. Okay, so we have Karthikeyan who is still leading, followed by Navi, Rakesh, Ashish, and Bhagya. Moving on to the next question.
Okay. The third question is, which type of suture is commonly used to secure a suction drain to the skin? This is a
This is also
PPYQ.
one question where if you do your internship properly, you'll get to know the answer. So what I feel is general surgery is more related to
Yes,
internship procedures. What is your opinion, Manoj?
true, sir. Very true.
Yes, so the answer is nylon or silk. So those who have done this will know this nylon
Yeah.
suture, silk suture. Okay, so most of them have answered it right. Looking at the leaderboard, Karthikeyan is leading, followed by Navi, Ram, Breaking Bad, and Urvashi. So Karthikeyan also has got the longest
I
streak
think
right now.
from third position it's changing, sir.
Yeah, yeah, right.
Yeah.
So here is a fourth question. The primary function of a rampless sponge holder is to, I think the question itself is the answer.
Yeah,
So
self-explanatory.
yeah, again, if you're doing did properly
Can we
internship,
expect these kind of questions, sir, in the exam?
definitely, definitely you can expect. And people make mistake
Mm-hmm.
also in these questions. But they'll
Mm-hmm.
show like the primary function of this holder is like they won't give the name of the instrument as such. So you'll be pretty much confused. So there are questions
Mm-hmm.
commonly asked on instruments with like, for example, needles, scissors, type of scissors, and other
Mm-hmm.
various instruments. Now I don't remember
Mm-hmm.
most of them because I'm from pediatrics.
Yes, sir.
So Karthikeyan is still leading, followed by Ram, Rakshaya, Urvashi, and Breaking Bad. Okay, so I think other than Karthikeyan, all are like new players. Haven't seen them
Yeah.
before.
Yes, sir. I think Rakshya was there, sir, from the beginning.
Yeah, Rakshaya was there, right? Yeah.
Yeah. Okay. Moving on to the fifth one. The QSOFA score is used to assess the severity of which of the following condition?
Again, QSOFA is a very important question from a clinical point of view also. So either you are in medicine or you're in pediatrics or you're studying patho, all these places will get QSOFA score. Okay, so there's no way you can miss this. Questions can also be asked on different components of QSOFA score also. So I guess most of them will get it right. There's no doubt about it. Okay, yes, the answer is sepsis. Almost everyone has got it right. I think someone got it confused for Chad Vass to score.
Ah, yes, sir.
Could be. That's why the two people who initial two people had answered question
Yeah.
probably. So leaderboard is pretty much same for top three. Urvash is also was also there in the previous leaderboard. ER is right now at fourth place. Okay, Urvash and ER. So at fifth position we have sixth position we have Breaking Bad. Seventh we have Kushal. Eighth we have Madhu. Ninth Krishna and tenth Rema. Good going, guys. So moving on to the next question. So here is a 2-year-old child who presents with a soft, painless swelling in the left side of the neck, which is brilliantly transilluminant and surgery resident does the excision. So your question is, which nerve is most likely to get injured in this procedure? So nowadays you'll see these type of questions are most frequently asked in surgery.
Yes, sir. They're testing both surgery, anatomy
Yeah.
as well in one question.
Yeah, right. So if you know the diagnosis, like what's swelling this could be, the age of the child is a clue, soft painless swelling is a
Mm.
clue, and on the left side of the neck and brilliantly transilluminant is a clue. Because there are very few DDs for brilliantly transilluminant, right, Manoj?
Yes, sir. Yes, sir.
So if you know that, then you know the area. If you know the area, then you know which nerve
Mm.
passes through it. So it is cystic hygroma. So and the spinal accessory nerve runs through this area. So supplying sternocleidomastoid and trapezius. So that's why one more question that can be asked is like they can tell that after this the patient could not shrug his shoulder. So which nerve is most likely to be injured?
Yeah. Other way to confuse
Yeah.
thinking more level.
So Karthikeyan has made a mistake in this question. That's why Ram is leading now, followed by Urvashi, Raksha, Breaking Bad, and AR.
Three more questions, guys. So here's your seventh question. A 30-year-old man presents with painless ulcer on the lower leg. He recently returned from a trip to a tropical region where he walked barefoot in a swampy areas. On examination, the ulcer had punched out edges with pale granulation tissue. What is your most likely diagnosis?
So the clue in this is one is painless ulcer, second is tropical region, third is walking barefoot, and the fourth is ulcer with punch out edges, okay, with pale granulation. I think this was a
I
little bit
think
tough question.
barefoot gives the yes.
Yeah, barefoot gives it. Yeah, right. Okay. Breaking Bad is leading now, followed by AR, Madhu, Faizi, and Karthikeyan. Moving on to the eighth question. 45-year-old male presents with the high-speed motor vehicle accident. He has hypotension, bradycardia, low pulse volume, hypothermia, low GVP, and low cardiac output. So classical case. Okay, so low cardiac output, low GVP should guide you towards the diagnosis.
Yeah,
And
this
also
is a type of
hypotension
shock
and
where
bradycardia. Hmm.
yes, sir, there's a problem with autonomic nervous system.
Yes. Most of them thought this was related to the low hypovolemia due to blood loss, but this is a neurogenic shock. The clue is bradycardia. Okay, in hypovolemic shock,
Yes,
you will
sir.
get tachycardia. So this is one of the
Hmm.
most important clue, bradycardia. Okay.
Yeah, easy way to remember is that everything is decreased in neurogenic shock.
Yeah, right. I think now tables would turn a lot. Breaking Bad is leading with the
Yeah.
highest streak so far, followed by Madhu, Karthikeyan, Ram, and Yashwant, followed by Urvashi.
Okay, moving on to the ninth question. A 60-year-old patient with BP 190 by 110 had a hand laceration which needed suturing. What is the next best step?
So you have four clues right here. So BP is 190, 110, uh, which is a problem for managing this local issue. So controlling hypertension in such cases is very important because such hypertension can lead to profuse bleeding, okay, during suturing. So that's the first you will control BP and then you will be going ahead with suturing. So one more question that can be asked is which is the drug of choice for this condition for
Hmm.
hypertensive urgency? Okay, because here the patient is not presenting with any target on the end organ damage. So we are assuming it is hypertensive urgency. So in this case, to lower BP, the drug of choice will be IV labetalol.
Yes, sir. If we do immediate suturing, we can get reactionary hemorrhage, right, sir?
Yeah. So the leaderboard is pretty much the same. Moving on to your last question. During surgery, the monopolar cautery is used to coagulate a bleeding vessel. What is the required setup for this operation? So basically, what is the principle behind monopolar cautery?
Yeah, this can also be a potential question, as you have to know the difference between bipolar, monopolar, what surgeries they can be used, what are their components, everything.
Yes, most of them have got it right. Monopolar because it has one active electrode and there is a grounding pad, correct? So again, if you are doing internship, if you have done well, then you will notice that there is a difference between bipolar. You notice two different cauteries that are being used.
Hmm.
So here is a final leaderboard, and Breaking Bad has won this quiz with
Yeah,
832 points. Congratulations, Breaking Bad. You
Yeah,
deserve.
congrats, Breaking Bad.
At second place, we have Madhu. Congratulations, Madhu. And at third place, we have Karthikeyan. Karthikeyan, despite a mistake, has managed to come at third place, which is really wonderful.
Yeah. Yes, sir. Congratulations, guys.
At fourth place, we have Yashwant. Fifth place, we have Urvashi. Sixth, Navi. Seventh, Ashish. Eighth, Soumya Shri. Again, eighth place, okay, there are three people. That is Ram, CK, and Soumya Shri. So congratulations, guys. Come back to YouTube Live. How was the quiz? Let us know in the YouTube Live comment section. So by now you would have known how important general surgery is, okay? Without general surgery, reading surgery is of no use. That's why we started with the most important topic, that is general surgery. For those people who couldn't complete general surgery on time, that is today, you have extra day on when you study for this one, that is grand finale of surgery, that is on 26th January, okay? So at that time you can go through things which you couldn't complete today, okay? So if you have any doubts, you can ask in the live chat of YouTube videos. Okay? So we'll be monitoring it and we'll be answering to you if you have any doubts. Okay, one of them has asked, Rupal is missing. Yeah, not everyone will be free. So whenever I have duty, Manoj and Rupal will handle the quiz. And whenever other guys are on duty or are busy, so we'll manage it accordingly. So tomorrow we'll have topic on trauma, right, Manoj? Trauma plus
Yes, sir. Trauma.
endocrinitis.
We have trauma and 1 minute.
Lower GIT.
Trauma and lower GI, sir.
Okay. So the reason behind putting trauma and lower GIT together was because trauma is an important topic, lower GIT is a less important topic. Okay. So they'll be having equal distribution because according to the exam only. Okay. So because trauma has more weightage and lower GIT has less weightage, so we'll be having more questions from trauma as compared to lower GIT. So around 3 to 4 questions will be from trauma itself, even maybe 5 questions, and less questions from lower GIT. And lower GIT, the most important topics are colorectal cancer. Okay, I think that is the only most important topic. Okay, rest of the topics not much is asked. Okay, one more is Crohn's disease and inflammatory bowel disease. So that surgical management of that, that is important. Other than that, not much is important. So we'll be focusing mainly on trauma only. Okay, because every year many questions are asked. Okay. So the Harsh voice has asked, sir, will you guide us for NEET PG 2026? Okay, if you're preparing for NEET PG 2026, then start attempting these quizzes, okay, so that at least you know what is important. Solve PYQs of these respective topics and you appear for these quizzes, okay? That is one thing which I can tell you, because in the next 6 months, we are going to continue these quizzes throughout the 6 months, okay? So during this 6 months, you will come through various type of PYQs, you will come through various things that you will realize through these sessions, okay? Just dedicating half an hour of your uh, like total time in a day will actually be very useful for your preparation later on in 2026. Okay. So thank you, Dr. Duncanshan and Vishnupriya. Yeah, we'll continue these sessions. Okay. So tomorrow we'll have one more session on trauma and lower GIT. Okay. So I think one day is more than enough for that. So if you study for around 7 to 8 hours, then you can easily manage. Yeah. So any else doubt, or should we conclude this session? Okay, there are no more doubts. So we'll conclude this session. See you guys tomorrow at 10 p.m.